So welcome to Southern Health Podcast, conversation with Perinatal Psychology, talking about maternal mental health because your mental health matters for you and your children. So my name is Dr. Naomi Page, and I'm a clinical psychologist in the Perinatal Mental Health community team. And today I have two guests with me.
So my name is Lindsey Q. I am a nursery nurse who works in the community for the perinatal team.
My name is Narelle Mullins and I'm also a community perinatal nursery nurse.
Wonderful. And today we're here to talk about the importance of connection in the perinatal period. So when we talk about that, I'm interested what kind of first brings to your minds, because I guess for me, I think about connection beginning, in that early antenatal stage.
Yeah, I guess, but that's where the mum and other members of the family first start to communicate with the baby. So I would say it definitely starts in the antenatal period. If mum's able to, sometimes it's difficult to connect with that baby, but the first signs of communication between baby and mum often start in the antenatal period.
And that sometimes that starts at those first scans. So actually first having something visible to kind of see that there is a baby there, because sometimes for some mums it can feel quite detached up to that point, I think.
Yeah, it can feel quite abstract, can't it, until you see that scan and there's something to kind of really focus in on. And that communication, I guess it and connection isn't just built through kind of words and talking, which again can feel quite difficult when that baby is still inside, but in terms of kind of touch and kind of that physical kind of bond as well, bond with the changing body of the mum.
Yeah, I think it's important for mum and kind of any parent to set time aside to have the opportunity to do that. So whether that's kind of massaging the bump or whatever families tend to do, it's an important part of the connection.
And I wonder how we think that might have been impacted by COVID, because I'm wondering if people maybe might not have been able to have such close proximity with their important others and share that news in the same way that they might have done, before the pandemic, how that might have impacted people's kind of connection journey with their unborn babies.
I think a lot of mums have found it really isolating and sort of adds to the feeling that it's maybe not real, that nobody else is helping to celebrate the coming of this baby. So mums have often been on their own trying to manage being joyful about the baby, trying to communicate with the baby, but not having that support of other people.
Yeah, and that feels quite sad to think about managing that on your own, maybe feeling quite isolated with that. Because thinking about celebrating and getting excited about the kind of the upcoming arrival feels so important in terms of that transition into parenthood or into being a family.
And also for the baby to hear all the different voices around it and to learn about language and sounds. And we are really meant to live in big groups, and COVID has sort of taken that away, that group setting where babies and mums can start sharing all that communication in the early stages.
Yeah, and so I guess now we're talking about after babies arrived in that postnatal period, what the connection there is like. What do we think is important to think about in terms of that early connection? I guess one thing that I'm always struck by is how babies are born to communicate. They're born with such a wide array of skills to really pull us in and cue us into what they need, and how it can feel really difficult to read those.
Really difficult. And I think COVID has had a massive impact on that, because there hasn't been the support for mums, but also particularly if it's your first baby, you haven't had the opportunity to kind of see it role modelled in other kind of parent and baby cohorts. So I think it's tricky to learn. A lot of people will tell you it's natural, and sometimes it is, but it's okay if it doesn't come to a lot later. I think kind of picking up on those cues and feeling like you know what your baby's trying to tell you.
Yeah, that importance of kind of linking in with other groups and like you say, like not having maybe had the opportunity to attend mother and baby groups or other kind of parent support groups, and just normalise some of those challenges that new parents, even if this isn't your first child, but parents of kind of new babies might experience in terms of making sense of how their child is communicating with them.
In our job, in our role in the team, that's where we come in to really simplify it down to what your baby's trying to tell you and how you can watch and learn your baby's temperament, what your baby likes and doesn't like. So we have lots of different strategies to find out what your baby likes to respond to, what makes your baby interested, and really simplifying it down and reassuring mums that with lots of the stresses and strains that come with mums under our teams, that it's okay to have this relationship that's really simple and not too complicated, and just seeing what makes the baby happy. And it's often really simple little things that we concentrate on.
I really like that idea, Narelle, of this just kind of slowing down in the relationship, slowing down and listening.
There's a lot of challenges out there with social media on how things should be. I think what we do is try and strip all that away and just get it down to what is actually happening, and sort of rejoice in that, really, with lots of different things that we use in our job.
And I think potentially that's potentially been a positive of COVID, in that there hasn't been the pressure to get out and do kind of in the early postnatal period. So mums have had that time to spend at home, just to kind of have a slow introduction to motherhood, and get to know the baby, and for siblings, etc., who were at home. Families that were all at home kind of during the early lockdowns, they've all had that time together just to get to know this new person, and to discover what they like and what they don't like.
And alongside that kind of that social connection, building that social connection in the ways that you're saying, it also makes me think about having that increased time to just kind of sit with your baby, hold them in kind of the importance of that physical connection as well, that skin to skin bonding, and how sometimes in the early postnatal period it can feel like we're under that pressure to introduce baby to other people, pass them round, and like you say, celebrate and rejoice. And whilst that's an important part of it, actually having that time for you and baby, or the immediate family and the baby as well. And so I wonder if there's been any other kind of challenges associated with COVID in terms of when things maybe don't go so well for mums, or when there are challenges for mums in building that bond, whether that can leave people feeling more alone. I don't know. What do you think?
Potentially would be the impact that it's probably been quite a lonely place to be if there have been challenges in motherhood. I think what COVID has done is taken that wider support network away, and in professional roles it's taken a lot of the kind of face-to-face contact away. So yeah, I imagine it's a very lonely place.
Yeah, so a lonely place, lots of kind of maybe losses associated with COVID and the pandemic, but maybe some potential gains to be had in terms of that slowing down that you talked about, Lindsey.
Yeah.
And what would you say you wanted, if we were able to give some kind of just a key takeaway note about the importance of connection with our babies? What would we think that might be?
It's something I say a lot, but I always say never underestimate the value of the little things. So the little bits of interaction that you get perhaps during a feed or during a nappy change. It doesn't have to be the big things. You don't need kind of the all singing, all dancing, groups, toys, etc. You can just focus on the small things, and they are the things that make the big difference.
That's lovely.
I would agree. That one of the mums showed me a poem once, and it's about the value of sitting doing nothing, but it meaning everything for the baby, just to be sitting with them and giving them that chance to look at you, to babble with you, to touch you, are the really valuable things in early communication.
Yeah. So yeah, I think that's the takeaway, isn't it? That the little things can be the most important things. The slowing down can be the most useful.
Yeah, definitely.
Thank you. So if you have been affected at all by what we have been talking about today, you can access support through your GP, health visitor, midwife, or call 111 who have mental health experts on hand. You can also go to the Southern Health website and click the Help in a Crisis link, which is a list of local support contacts. Thank you so much for listening to Conversations with Perinatal Psychology, talking about maternal mental health, because your mental health matters for both you and your kids.